With a sober heart, I must announce this morning that COVID-19 has reached our country.
So the cabinet decided that we should declare a state of emergency.
All right, welcome to episode 6 of the COVID-19 podcast. This is where we debunk myths and talk everything COVID-19. It's been, it looks like yesterday when the first episode was recorded, but we're moving forward and we're hoping that we inform the public out there with regards to COVID-19 and everything. And speaking of COVID, we are a year now. It's been a year since the first case was reported. And I must say, it's been interesting. So today, I'm joined by Mr. Cristie Keulder. He is a researcher at the Survey Warehouse. Maybe welcome, Cristie.
Thank you very much.
Yeah, let's just start off by maybe giving. I would like to know more information about what you do. You are a researcher at Survey, but what you do and what your organization is all about.
Okay, yeah, and thank you for the opportunity. We're a local Namibian market research company. We specialize in data collection, both qualitative and quantitative. We've been around now for more than 2 decades. So we're one of the original research companies that started after independence. We work in a variety of fields. We are the organization, the preferred supplier or partner to the Afrobarometer, which is a survey that runs in 36 to 38 African countries. It's being done every second year. We've been doing that since 1999, so about 20 years now that we're with that project. We also do work in public health. We do work in commercial, on the commercial side. And right now, for the last year or so with COVID, we've done a large number of COVID-related projects, research projects.
All right. I asked you that because it's very important that we establish, a trust with our listeners, especially the community, so that we know that we are speaking to the right person when it comes to COVID-19 related matters and researching and just finding out facts and all of that. With that said, today we are talking about the pandemic itself, as we always do. It's been a year now. Maybe let's on a lighter note. Where were you when the first case was reported?
Well, I was exactly at the same place where I spend most of my days, which is behind my desk. I've been working from home long before it was fashionable to do so or necessary to do so. So I was at that very same space when the call came through to say the first cases has been reported.
Interesting. Mine is an interesting one. I was outside our borders.
Oh, okay.
Yes. So yeah. Yeah, no, I say that because I want us to start off by it's been a year since the pandemic has started. Let's look at the social aspect. How has it affected the social aspect of life?
Well, I think, that's one of the things where we don't have a final answer yet, but we've got pretty good clues. I remember shortly after the first lockdown was called, I realized that here was an opportunity for us to start gathering information about this pandemic. At the time, we didn't know how long it was going to last. We didn't know how it was going to play out. So we approached donors to see if we could raise some funding to do projects. And one of the things that we were interested in is to see how Namibian households are going to cope with this. I think one of the problems that we've seen is those people who were interviewed about how they perceive the pandemic and how serious it is, they were quite optimistic I would almost say the first month after the pandemic or the lockdown had been called. By the end of that month, the views had changed completely. People realized it was really serious and it was a long-term impact. So I think we're still trying to come to terms. We are now standing in front of what could possibly be a third wave. Our first wave was during June, July last year, and that was the sort of winter season. The second wave was November and December and January, which was the sort of holiday peak. We now have another peak, which seems to coincide with the opening of schools. And if we go by that flow, then in about 2 or 3 months from now, we'll have yet another peak. So I think we're getting used to the fact that this pandemic is not over, and the virus is certainly not going to go away.
And then there's also a new variant that's kicking in there also.
Yes.
So looking at it, let's look at the economy, the impact of the economy. And when we talk about it, I want us to go deep into the small SMEs, the community, that little guy, even that little guy on the street, that guy who now sells masks because he stopped, because he saw that there's a niche or there's a market there. The impact, because in the column you mentioned about the economic impact, but let's go deeper to that level. How was it there? How did it impact the SME sector to that level?
Well, I think the impact has been devastating, especially in some sectors, not all sectors. I think, tourism is one example that people often use for how serious the impact had been. As a general rule of thumb, our research on businesses show that most businesses, by the time lockdown came and their activities were stopped, their economic activities, would probably have been able to survive 3 to 6 months with enough cash stowed away. But with no demand, that money was sort of used up quite quickly. So SMEs are the most likely to have closed down during this pandemic, and businesses that has closed down are not reopening. They were probably also the first companies that started looking at ways to survive by either retrenching workers, closing down, as I said, permanently, or by reducing wages. And that again meant that a lot of people who has lost their jobs has now entered the informal sector to try and make a living. So that guy with a mask might have had a job yesterday or the week before or the month before. And the longer this pandemic goes on, and remember I said we might face another big peak in winter, so we might have more lockdowns. In fact, Europe is now locking down for the third time. So that might come our way too. The longer this goes on, the more of the small businesses will close down. There's no doubt about it, especially in the areas of tourism, hospitality, restaurants, those kinds of activities, and even in construction, if they haven't closed down already.
Very, very alarming. And so now, you mentioned the second wave happened around November to January. So can we say that when traveling was reintroduced and then the borders were strategically opened, could have that been the reason why the second wave came about? And how do we learn? What can we learn from that and do something about it?
Yeah, well, definitely. I think there were a couple of ways. One was that there were many more people wanting to come to Namibia, especially from South Africa. So that had implications of people being tested, especially when they go back home. So they had to go back with a test. At the same time, Namibians wanted to cross the border. That meant that more Namibians were tested. So the more people travel, the more tested, or the more testing was done. And that, I think, has sort of had an effect on how many people actually tested positive. Not that more testing means more people are positive, but more testing means we're coming closer to the truth as to how many people are infected. I think the change of tests, maybe the rapid tests, the adoption of the rapid tests, also had an impact on our ability to more accurately assess how the infections have been spread. So yes, mobility has something to do with it. This is why they've locked down, parts of the country in the beginning. I don't think we would be able to do a complete second lockdown or a lockdown, compared to what we've had last year, because I think there is simply not enough left in the economy to be able to handle that.
Then, with that said, what can we now look forward to if we are to be at that point?
Well, I think we need to continue fighting the virus, and we know what to do. We have to wear masks. We have to sort of practice washing hands, avoiding crowded spaces, stop going to large parties, not having big events. We know what to do. It's just that some people are getting tired of doing it, and people are refusing to wear masks and so forth. What they call sort of pandemic fatigue sets in. People lose focus, people don't care enough, or they stop caring. And that, I think, is the danger. The more this goes on, it's not going away. So we need to be consistent in our application of these emergency rules.
Mm-hmm. All right. So you mentioned fatigue, the term fatigue, but also another term that has been now in this topic of COVID-19 is the disinformation factor. Now, when we reflect 1 year on, how has the pandemic affected how people digest information?
Well, I think it's had a huge effect. I think this pandemic has taught us that we absolutely need people's trust if we want to govern. Government needs the trust of people so that people follow the guidelines of government. The sources of information needs to be trusted. Otherwise, we end up in this situation where we get information that's contradictory or partly false or completely false. And I think what we've seen is that this pandemic has deteriorated trust quite a lot, trusting each other. Because I need to trust you to wear a mask. I need to trust you to wash your hands because it's not just your safety, it's also mine. Interpersonal trust has been on declining. And I think it is probably, I haven't seen, we might have some figures come the next month or so about that. But I think that's one thing that's gone down. Trust in government's definitely got down. We've got evidence of that. Trust in healthcare workers is crucial. Otherwise, people aren't going to follow programs. So I think disinformation has a huge impact on trust. People don't know who to trust anymore. People don't know what to trust. And I think that's put everybody back quite a bit.
How do we, I mean, that's why we're here though, but what do we do to keep on addressing this, especially disinformation, addressing it to a point that people understand? Because the vaccine has been there before. Okay, I'll get to the vaccine later, but how do we address the disinformation?
Well, that's difficult. I think people have to make clever choices, right? I think it calls for openness, transparency, and accuracy from government communications, timely communications. I think people are better off relying on traditional or trustworthy news agencies for their news. People that go through a vetting process in order to compile their reporting, or people that fact check the messages before they go out. I think one of the big problems is that we've become very reliant on interpersonal communications. So these days, everybody is almost like an expert on the virus. So my uncle tells me this, or my aunt has heard that. And that's where normally we trust the sources because they're family or they're friends, they're known to us. But I think that's where we need to be more careful in terms of what we hear and how much we trust what comes in. I think there's a need to trust the traditional strong media houses that has a approved process of vetting and fact-checking.
Let's talk about the vaccine. We're speaking a year on later, and we're speaking a possible third wave coming. Putting the vaccine coming into play, how is it going to help with regards to whether there will be a third wave or not?
Okay, I think, first of all, we need to understand that if there's no vaccine, this is not going to go away. Okay. And the longer we wait to get our people vaccinated, the more variants of the virus we'll have to fight. And with every new variant, the chances are that the vaccines will become less effective. Mm-hmm. So the longer we wait, the more varieties we get, the more ineffective the vaccinations will be. So the idea is that you try and get as many people vaccinated to get this pandemic under control. I think we've now received a gift in terms of the vaccinations. I don't know much about that vaccination. I have to say, there's not much published about it. But I think one of the misinformation campaigns or the disinformation campaigns has been that, vaccines are bad for you. It's going to cause all these problems. It's been developed too quickly. It's not been properly tested. The problem with those is if we believe those arguments, we are actually undermining our ability to recover from this pandemic. As I said, if we don't do a vaccination process and if we don't achieve the so-called herd immunity, then we're going to remain in trouble. New variants are going to come up, vaccines aren't going to help, and we're going to go into a process where this becomes our normal life. Every 2 months, we'll have a wave that lasts 2 months, and we'll have to close everything down. We will get used to a life without travelers. There are all kinds of complications all of a sudden coming up. For example, Iceland has become the first country that has now issued a digital vaccine passport or a health passport, which will in future, although the European Union is still debating all of it, it will become the norm in future. And if you don't have one of those, you will not be able to travel. And if you don't have a vaccination program or a herd immunity in your population, you will not be able to accept travelers from certain countries. So we can't really afford not to vaccinate. So every one of these arguments that states that vaccinations are bad or that they, whatever people believe. Yeah. Look, the point is none of them so far had proven to be fatal to people or to make people very sick. I know there are some problems around the AstraZeneca vaccine now, which the WHO has approved and said there's nothing wrong with it. But some countries in Europe has now suspended that vaccination to establish whether it can be associated with blood clots in the brain. Thus far, there's been no evidence, but they are pursuing that. And until they can find conclusive proof for it, they're not going to continue with that.
Mm-hmm. All right, we're about to sum up very soon. But if you are listening, at the end of this podcast, of course, we will have a Q&A session where you can come in and ask your questions that you would like to the expert that will provide for you. So if you are thinking of anything, just stick around and then you ask your questions. But the final question that I have, Cristie, is the distribution. Are there opportunities there, maybe the distribution of the vaccine? Can we have something good there in terms of economic ways? Because I saw the ministry, I think, was put something in the newspaper in terms of procuring the vaccine. I don't know, do we have maybe people, if that's the aspect, is it something good there?
Well, I think, just on a point of clarification, I think we need to understand that much of the distribution of vaccines the world over are being done by airlines. They are being done by courier companies. FedEx is big in the US. I'm sure DHL is working somewhere else. So those companies would have an understanding of the protocols that are required, because it's not as simple as taking a box of vaccines, put it in your pocket and go to the next place, or put it in the backseat of your car and drive to where you need to go and deliver it. There are very strict protocols on how these drugs are supposed to be stored and what temperature they need to be kept at and how they need to be transported and when they have to be used, how long can they survive outside their initial protective environment. So that's not something that everybody can do. You need specialists to be able to do that. At the same time, I think we already have at least companies that are internationally involved in this process. We have them here and they would have access to that kind of expertise. For example, some of the vaccines require a really low temperature, which can only be achieved by dry ice or liquid nitrogen, which is not something every human being know how to handle. Those things can be very lethal. At the same time, some of them only require normal cooling and storage in a normal refrigerator. So it depends on what vaccines we are using. It depends on where we want to take them. And it depends on what kinds of conditions we meet on the other end. It wouldn't make sense to store vaccines in dry ice in an area that doesn't have access to dry ice, right? So I think all of that needs to be factored into this rollout that we know actually very little about at the moment.
Definitely. Just maybe take away if there's anything that we haven't discussed, something that you would like to maybe bring there. I think this is the time that we can put it out there.
Yeah, I think, it's easy to focus on the bad things, but I also think there has been a number of very good things that came from this. And one of the things that impressed me was the way ordinary people got together and started building bridges in order to address problems. I think people were forced to reach out. I think this year there's going to be more need for that. We will have to lean more on each other. I think one of the things that we will discuss in future, for example, is the psychological impact that this disease has had by means of excessive stress and causing anxiety, and how households would have to deal with that. So I think the emphasis on interpersonal relationships is going to be a key way for us to go forward.
Cristie, thank you very much for making time today and having this discussion with me.
Thank you. It's been my pleasure, and thanks for having me.
All right, and that's it for today's episode 6 COVID-19 podcast. Do join us again next week as we speak anything COVID and as well as debunk myths and facts surrounding the pandemic. We do leave you with the voices of the people that we recorded in the streets and just reflecting on how it has been living with COVID-19. Bye-bye.
I would say that I've learned a lot through these 12 months of experiencing COVID-19. For example, I learned that there's power in groups, but when it comes to something like COVID-19, the best thing to do is not to be in a group. I've also learned better money saving tactics because things have gotten expensive over the year, and also, even the educational sector has also been influenced a lot. For example, I was grade 12 last year, and it really took an impact on me because we had less time to do the whole curriculum.
Well, basically mostly hygiene wise, washing hands more, sanitizing more, and keeping clean more. I guess that's the positive part. And plus, to appreciate people around you more, because a lot of people have been dying though. So, and plus, what else? I think that's all. And the whole social distancing, and somehow I feel like it's bad because now they're keeping us away from our people. But yeah, kind of learn a lot though. So it's the bad and the good parts.
It has been tough as usual, It has been tough because economies has been going down and people have lost jobs. We have to start from the scratch again, and it's tough. It's not an easy task, but we have to live with it, But it has been tough. It has been tough. Nothing easy, especially this time, the moment. Yeah, a tough time.
From that COVID-19, this is now the whole year. What I learned is something very, very important. Is to save money, from how to use it money, how can I use it to spare money, is it necessary things. And the other things, because I have been here now, it's almost a year, but without work. But according to my knowledge, really, this COVID-19, they learn is how to use money. Because
I actually learned a lot of things. It's like we are living, it's like we are separated from our loved ones. You're not allowed to walk around anymore. And most of all, COVID is all about keeping up with hygiene. You wash your hands, you sanitize, to protect yourself from the virus and all that. And yeah.
What I mostly learned is how to save, how to spend money wisely, and that the economy is basically it's messed up. So when it comes to money wise, you have to be smart, how to spend it and to live under rules. It's tough for us. Because now you have curfews and all that stuff that we have daily. So it's basically we are in a cage. It's like apartheid all over again. Yeah.